Many people still believe that epilepsy is brought about by curses. Many believe that these people are tormented by demons, and so many other types of myths that occur with epilepsy. Some believe that you cannot eat with these people, you cannot share utensils, and these people, some of them believe that they are not part of the society.
Dul me no ma ka ja yigni apar gadik ne ma choni ni ma ka no ne ni ne nyalo bit no ni kata mana jonyuol na mi samoro loko na tuo mandu ni koro ne giwacho ni mondo gini mondo ringo ter ka jalimo.
So basically what we are bringing out is epilepsy is treatable. Bring these people out so that we treat them.
Greetings. Did you know that in Kenya, at any given population of 1,000, 18 people suffer from epilepsy? Did you know that epilepsy is a medical condition that can be treated? And epilepsy is a condition that can get any person at any given age. In our daily lives, I'm sure that you may have encountered or witnessed someone suddenly falling down and they start having convulsions or seizures. In most cases, they are left unattended or ignored due to the stigma, misconception, and fear. Epilepsy management imposes a huge physical, psychological, social, and economic burden on individuals and their families. In this special feature, adopted from your most favorite and informative radio health program, Ngima and Mwandu, produced in Doluo from Transworld Radio Kenya, we are going to be joined by Nicholas Otieno, a medical expert specialized in epilepsy and working with the Kenya Association for the Welfare of People Living with Epilepsy. Welcome.
My name is Nicholas Otieno. I work for an organization known as KAWE. KAWE basically stands for the Kenya Association for the Welfare of People with Epilepsy, and our main mission is to facilitate the lifestyle of people with epilepsy so that they live their life as any other person in the society. Our vision is to see these people living their life to full potential. Epilepsy basically is a neurological disease that involves the brain cells, and it is basically characterized by seizures. Seizures are basically discharges produced by the brain, and in these people with epilepsy, their discharges are more than the required amount that is supposed to be discharged by the brain. Yeah, the seizures are there, but they come in different ways. Yeah, because there are different types of epilepsy. There's the focal type of epilepsy and there's the generalized type of epilepsy. In the focal type of epilepsy, they are also divided into three types: the simple focal, the complex focal, and the simple complex generalized. And then there is the generalized types of seizures, which are also divided into 5. So the different types of seizures are characterized by the part of the brain involved. In the partial seizures, a part of the brain is affected, and in the generalized seizures, the whole brain is affected. So that is how the difference comes. Basically, epilepsy is caused by so many things. Epilepsy might be caused by trauma to the brain. It might be caused by road traffic accidents. It might be caused by infections affecting the brain cells like meningitis and cerebral malaria. It might also be caused by space-occupying lesions like the growths, benign and malignant growths, and even drug and alcohol abuse. So it's a wide range of causes of epilepsy. Yeah, epilepsy in children might be caused by injuries during pregnancy and might also be brought up by injuries during delivery. The injuries during pregnancy might be due to trauma or infections on the mother's side. During delivery, it might be caused by injuries when the child is being born, if the process was not taken care of properly. Yeah, so basically epilepsy is very treatable. So many people don't know that. And when you come to our facilities like where we are now, we will take your complete history. We will do a physical exam. We will do our investigations, the physical exams and the EEGs and the CT scans. Then from there, we start now deciding on which type of drugs you'll be on. So the management of epilepsy is a long-term management, but it does not mean that it's a lifetime management. There'll come a time that we will start reducing your drugs as per the level of your response to our drugs. So there will come a time when we'll stop tapering down our drugs, and eventually we will take you out of the drugs, but it's a long-term management. That is why I said that there'll come a point where we will start tapering off your drugs. And most of the time the criteria we use is when you've been off seizures for at least 2 years, we start reducing the drugs. The drugs we are reducing so that we get to a position known as the zero level of drugs. This is where you are no longer taking drugs, but you're still on follow-up. We are still monitoring your activities and making sure that the seizures don't come back. So it is treatable. Epilepsy can be gotten by any individual, from the young youth, the children, up until the elderly. So it depends with the cause. I had said initially that you can get it through road traffic accident, you can get them through infections, you can get them through surgeries and all that. And we said that children can get it when their mothers are going through pregnancy, during childbirth. So it's a disease that does not really have a specific age. It cuts across all ages. Yeah. So, and again, in Kenya, about 18 people out of 1,000 will have epilepsy. Out of a population of 1,000 people, about 18 will have epilepsy. And in the world, you have about 50 million individuals having epilepsy. So it's basically a serious disease that should be looked into. The distribution of epilepsy is even, in that there is no specific area in the country that you can say that there is more prone on of epilepsy. Initially, before the whole program about universal health coverage had started and the primary health care focus had started, there were so many numbers of children being born and having epilepsy. That was due to there was no proper management of pregnancies and deliveries. But nowadays, after the universal health coverage and the primary health care focus got in, at least nowadays there is an improvement. So not so many children are born having these conditions, since the services have improved a bit. They are there, but not as much as they were before. The myths are the main reason why there is something called treatment gap. The treatment gap is the difference between those people who have epilepsy and they come for medication. The number of people who come for the medication is still low because of the scanty information and the myths. Many people still believe that epilepsy is brought about by curses. Many believe that these people are tormented by demons, and so many other types of myths that occur with epilepsy. Some believe that you cannot eat with these people, you cannot share utensils, and these people, some of them believe that they are not part of the society. And that is why most of them you'll find that they are hidden in their villages and homes. So basically what we are bringing out is epilepsy is treatable, bring these people out so that we treat them. The myths are there, but the myths are not true. These people can be treated and their medications are there just like any other disease. Basically, the percentage of epilepsy that is inherited is so low. We say that if one parent has epilepsy, the child has about 4% of chances of having epilepsy. And if both parents have epilepsy, the percentages rise to at least 20%. So as much as the inheritance part of it is there, it is so low.
Thank you, Nicholas, for taking us through what is epilepsy, the causes, the management, and who can get it, and some of the myths that are associated with epilepsy. In this next segment, we invite you to get to know some of the myths associated with the do's and don'ts for those people who are suffering an epileptic attack.
There have also been myths about what you should do when these people have a seizure. Most people believe that you should put a spoon, you should put a stick, you should start feeding them. So basically what should happen when you come across someone who is having a seizure, the first thing you should do is to stay calm. Don't panic. Because the moment you panic, you will not do anything. The second thing you will do is that you make sure that this person's head is protected. And by protecting this person's head, you'll either take a piece of cloth, or you'll take maybe a cloth or something soft, put under his head, and make sure that the environment that he is in is there are no harmful objects around there. Then the third thing that you do is if this guy is wearing a tie or wearing belts and such tightening materials, you make sure that you loosen them up. After that, you time this scissor. Most of these scissors don't last for more than 5 minutes. After timing them, you will wait until this guy recovers. After he recovers, you put him in a position known as the recovery position. The recovery position is the position where you take this guy's hand, you put it under his chin. After putting it under his chin, you lie him by the side. After lying him by the side, you pull one side of the foot on the knee side, you pull it up so that this guy does not lie on his abdomen. Don't try to put anything on this guy's mouth, so that you are trying to protect him from biting his tongue. By the time you start putting these things, you are injuring this guy more. Don't try to give this guy any fluids to take. Don't try to give this guy even medicine while he's having a seizure. Also, don't try to carry him when he's having a seizure. So make sure you are calm. You ensure that he's lying in a good position and there are no injuries. After the seizure, you put him in recovery position. Then after the recovery position, you reassure the patient of that the seizure is all done. Yeah, so basically that is all that entails first aid. Then you explain to them what happened to them after the seizure, because most of the time they will not know what has been happening to them. Most of the time, when these people are having an active seizure, we said that they are partial seizures and they are generalized seizures. The partial seizures may occur when this person is still alert. So this type of seizures will occur and this guy will know what has been happening. Then there's the generalized type of seizure where most of the time they lose their consciousness. And when they lose their consciousness, they will only tell you the moment the seizure was almost starting. And the moment the seizure started until it ended, they have no clue, because at that point, most of the time, their consciousness is usually gone. So they will not know completely what has been happening during that time. And that is why we mostly depend on information from a person who saw him during that seizure. Because as the patient at that particular point, he does not have a clue of what was happening. For the partial seizures, the effects will depend on the part of your brain that has been affected. So if it's the part of your brain that controls your hands, the response will be on your hands. If it's the part of your brain that affects your eyes, the response will be on your eyes. If it's the part of your brain that affects your lower limbs, the responses will be seen on your lower limbs. So it basically depends on the part of your brain that has been affected.
Dear viewer, by now, I know that you understand that anyone can develop epilepsy at any given time, but it onsets in young children and older adults. According to research published in 2021 by the National Center for Biotechnology Information, men develop epilepsy more often than women, possibly because of higher exposure to risk factors like alcohol use and head trauma. And according to data from WHO, the World Health Organization, epilepsy is still a major public health concern in many African countries. Around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. Nearly 80% of people with epilepsy live in low and middle income countries. It is estimated that up to 70% of people living with epilepsy could live seizure-free if properly diagnosed and treated. The risk of premature death in people with epilepsy is up to 3 times higher than for the general population. 3/4 of people with epilepsy living in low-income countries do not get the treatment they need. Daniel Otieno, a clinical volunteer at KAWE, is a good example that epilepsy, if well managed and we are able to overcome the stigma, can allow one to live a normal life. Here is Daniel's testimony of how epilepsy changed his life and how he overcame the challenges.
First, my name is Daniel Otieno Okeyo from Sakwabondo in Siaya County. I'm here in Uruma as a community health volunteer. I'm also a KAWE patient, and I'm also supporting KAWE in this epilepsy clinic. It is because I have epilepsy that I found myself here in KAWE. I first got an epileptic attack when I was 13 years old in class 7. That day, I experienced my first seizure. I had gone to fetch water and later on I woke up and found myself in the house. Then I asked, why am I in the house yet I had gone to fetch water? I was told that I fell down. I had some seizure, then my brother was called and came with his bicycle and carried me home. At that time, I was living with my brother. He also didn't know that what I had was epilepsy, and he thought that what I had was just a bad malaria. So he told me that I need to go to the hospital for a malaria test. And it didn't take long before I collapsed again, and this time it was in the house and he was present. And it was when he realized that this can't be malaria, and it confirmed what others had been saying, that I had epilepsy. My brother then went to our relatives to inform them on what was happening in my life. At that time, my father and mother were already dead. So our relatives did not accept this condition, and they started to suspect that the family enemies who may have killed our parents are the same ones who have transferred the curse to me. And the solution they gave was that this could only be treated by a traditional spiritual healer. So they took me to one for prayers. When I went there, the spiritual healer told me things that I didn't find helpful. I was told that this condition is a curse coming from someone within the family. So the traditional spiritual healer said, I will pray for you and tell you how this will end. He then demanded to be paid upfront 5,000 Kenyan shillings, that's around $42, to kickstart the prayer process. The healer again requested for a cow, because the prayers he was going to do was going to be continuous and not a one-off prayer day. Later on, my uncle is the one who heard about KAWE. So he inquired further and he discovered that KAWE is taking care of those with epilepsy. So he told my elder brother to organize how we can travel to Nairobi. So my brother and uncle were the ones who brought me here in Nairobi. The first day I went to KAWE clinic, I was taken to see the doctor, and then the doctor prescribed some medicine. All I can say is that ever since I started using the medicines, I have seen a lot of positive changes. For example, before I came here, I used to have constant epileptic attacks. It could get me anywhere, and sometimes I got to the house after falling on the roadside. And I can remember there is a day I got a seizure near a sewage. So when I arrived in the house, I was soaked in sewage water. So I went on with the medication and clinical visits, and I saw the seizure frequency reducing. Until nowadays, it only comes once in a while, but at night. I no longer have the daily daytime epileptic attacks. And that is the time I have realized that I had been suffering because I did not know where I could get help. Now, what I would like to say, especially to my Luo community, because we are the ones who are still holding on to some beliefs. And you can hear someone say that epilepsy is a transferred curse. Others say that they are evil spirits of your dead relatives. So you find someone has an epileptic attack, but they can't go to the hospital for treatment. Please be informed that epilepsy can be treated. It's only that it takes a longer period, and when you start using the medication, you need to be very keen and follow the instructions. If you don't follow the instructions, then it is as well as doing nothing. And then at the end, a person will start saying that they have not seen any benefit of the medication. You must take the medicine without fail. And if the doctor gives you an appointment, you must honor it. That is the only way you can be helped. Otherwise, if you don't do it, then it will be like you have done nothing. I want to give thanks to Transworld Radio for this opportunity they have given us today to teach the community about epilepsy.
Thank you, Nicholas, and the entire team at KAWE. And as the saying goes in Swahili, if we join hands together, pamoja tunaweza kukomesha kifafa. Now, if you understand the Luo, I invite you to join us every Wednesday at 8:45 p.m. on Radio Namlolu for a special segment feature touching on epilepsy and other diseases in your special and most informative health program in the Luo called Ngima Enwando, where the epilepsy conversation will continue. Thank you and God bless you.